welcome to Jessica. I'm your host, Jessica Rector. Now, in the past few years, we've heard how there's been a short supply of nurses. Today, we're going to talk about that field of nursing and about that industry, how we can get involved in that industry, and also if you're interested in becoming a nurse, how you can go about doing that. My guest today is a writer and a nurse. Her name is Sarita Stevens. Please welcome her.
Thank you.
Thank you for joining me today.
Quite welcome.
So tell us a little bit about your background.
Well, I grew up on Cherry Ames, which you may not know about. Cherry Ames was a nurse detective who was a companion to a cohort, of Nancy Drew.
Okay.
She solved crimes while she was helping patients in the hospitals. And it was Cherry Ames student nurse, Cherry Ames clinic nurse, Cherry Ames camp nurse, and all the while she was solving crimes. And that's what I wanted to do when I was 8 years old, 9 years old. I used to sneak away and buy with my allowance, the books. And then I got into nursing, and it wasn't at all like that.
That's what made you want to get into nursing?
That's what made me want to get into nursing in the first place. In fact, we're starting to redo some Cherry Ames right now with another publisher. I'm working on that.
Oh, very
nice.
But
to try and encourage more young people to go into nursing. But I was online one day, and I was feeling very not bored, but dissatisfied with my nursing, and found somebody had the handle Sleuth RN. And so I questioned her. Now, Sleuth RN would mean that she's solving crimes while she's a nurse.
Right.
And it turned out she was a sexual assault nurse. And Sandra Goldstein was her name, introduced me to the International Association of Forensic Nurses. Their main headquarters is in New Jersey, and their website is www.iafn.org. Anyway, I went to their first conference, and I was floored away.
Right.
It was fascinating about wounds, about telling the difference between stab wounds and entrance wounds and exit wounds, and just everything you could imagine from CSI and more.
Well, I think what's fascinating about nursing, whenever we talked before, is that I don't think people know the different fields that you can go into.
Oh, there's so many
pertaining
fields.
To nursing.
Yes.
So give us an example of a few different fields.
Well, in nursing itself, of course, there's med-surg, medical surgical nursing, pediatrics, oncology, clinic, home
Right.
health, Air Force, bush pilot, nurse, prison nurse. There's, maternity. There's just so
Right.
many different fields in nursing. But then when you go into forensic nursing, which is the new, actually all nurses are really forensic nurses. They just don't know it.
In what way are they?
Because we are the first ones that see the patient. We are the first ones that get the clues and hints and see what's going on. If, for instance, if you're a death investigator nurse and you go to the death scene as a forensic investigator nurse,
Right.
you will look at the body, you will see medications, you will be able to judge by the way the body is laying or what is happening, in the room, whether or not the death was a natural or unnatural death.
So what exactly is a forensic nurse?
Well, a forensic nurse the word forensic doesn't necessarily mean death. It means legal. So a forensic nurse handles anything to do with the law. So anytime there's a legal case coming up, a medical malpractice case, a workman's comp case, helping attorneys with, even like with Scott Peterson case,
Right.
Or with O.J. Simpson or with Colby Bryant, these all had places for forensic nurses in them. A forensic nurse helps attorneys and police with gathering evidence, with putting the pieces together, with educating. Most police do not have medical backgrounds. Very few of them know
Right.
anything about medicine at all. Very few lawyers or judges know anything about them.
So what
That's
do you
we
think
is
when
educate.
people first hear the term nurse, what kind of nurse are they thinking? What is going through their mind?
Well, when people first hear the term nurse, they think of the stereotypical, the white uniform and the starch cap. Most of us don't wear starch caps anymore. Caps have long gone.
Right.
For sterility purposes. In psychiatry, we wear street clothes so that we relate better to the patients.
Oh, yeah.
The operating room nurses wear scrubs.
Right.
It's not something that is the same. Nursing has really evolved quite a bit over the centuries.
In what ways?
Well, nurses have more autonomy. The nurse practitioner can write prescriptions, can do well baby exams, can make primary diagnoses.
So if they can do all that, what is the difference between a nurse then and being a doctor? Besides
Well,
the extra schooling, of course.
Well, the doctor deals with the more complex injuries, more complex wounds, more complex diseases. The doctor is the one that has to make the final decision, the final diagnosis. Nurses do not make diagnoses. We make not assumptions. We make it appears to be, this,
Right.
this, and this type of thing. We aren't supposed to make diagnoses. We make nursing diagnoses that the patient has an alteration in bowel habits. The patient has an alteration
Right.
in eating habits.
So what's
you
a
know.
nurse practitioner?
A nurse practitioner is one who can work independently, an NP, usually an advanced, a master's degree. She can be a midwife. She can work in, like Kaiser uses a lot of nurse practitioners for seeing patients just for initial visits.
And then after you see a nurse practitioner in that situation, then you would go on to see a doctor
if
they
you still
think-
needed it. If she could deal with simple things like rashes,
Right.
or with sore throats, or with fevers or flus, or things like that, and the doctor would be seen for things like cardiac stress or
Right.
kidney problems or medication. She can write certain medications, not all medications.
So once you get into the field of nursing, or say you're a college student and you want to go into nursing and you know that, how can you find out different types of nursing programs? Is it just one nursing program, and then when you go on to more schooling, you have to specialize, or how exactly
Well,
does
actually, there used to be hospital nursing, which is 3-year programs.
Right.
Those have gone by the wayside for the most part. Usually it's a 4-year program, a Bachelor of Science in Nursing, or a 2-year program, which is an AA degree. And those are more technically oriented nurses. They get more time on the floor. The bachelor-oriented nurses get more academic time because we do more of the head nursing, more of the academic stuff, more of the administrative stuff.
Right.
But they're both excellent nurses, and then you decide what area of nursing you want to go into.
So if you wanted to go into forensic nursing, what?
You would probably best go to a Bachelor of Science program and then take forensic courses on the side, take classes. I took classes in sexual assault education. I took classes in domestic violence assistance. I took classes in death investigation. These are all like seminars, week or 2 long seminars that I took, which educated me how to work in the field.
Right. So outside of the hospital nurses, outside of forensic nurses, what other kind of nurses would?
There's clinic nurses, there's home health, there's midwives, there's...
Now, do you need a basic nursing degree?
Yes, you need a basic
Okay.
nursing degree for almost all these fields.
Okay.
Yeah. And it's good to have some medical surgical background.
Right.
Actually, one of the books I'm working on right now for Adams Media is called Everything for the New Nurse, and we describe some of the different areas the nurses can go into: occupational health, even screen nurses. Who work like at the studios and stuff like that.
Right.
Because every production needs to have a nurse on call.
A nurse on call. Oh. So tell us about your book, your newest book.
My newest book. Okay. Well, actually, as you know, this is my 32nd book.
Right.
And it's about how we as nurses help police and attorneys with their cases and with their crimes. And one thing is that the nurse can do so many more things than they're given credit for.
For example?
For example, as a nurse, I look at the medical records, and I can decide what type of experts they need for this case. I can educate the jury as to what they need to understand. Nurses translate medicalese from doctor language into ordinary lay language. We communicate with the patient. We can talk about what is really there and in terms that the public understands.